Well, good morning, Texoma. Thanks for joining us this morning. We are taking an inside look at a smoke-free Falls. We're talking about the smoking ordinance that passed in Wichita Falls on June 17th. And joining me this morning is Amy Fagan. She is the Assistant Director of Health for Wichita Falls and Wichita County Public Health District. So, Amy, thank you for being here with us this morning.
Of course, it's a pleasure. Thank you for having us on.
Absolutely. And you know what? I'm just going to start, Amy, and I appreciate you. She's 2 weeks from being due, and we're excited for her and, of course, her family. But we're excited also to talk about this, so we appreciate you taking the time to be here. There's so much going on a lot of people don't know about that the health department's doing. One of those is actually cessation classes. I know they're free. They're getting out there and working with the youth. We're going to be talking about that coming up in just a bit. But first, let's just start with the ban.
Council voted on it in June, so we have 30 days for it to become into effect. So that will be July 17th. The ban on public smoking is for essentially those workplaces where workers are present. We do have a grandfather clause that is part of this ordinance, which is unusual, but we thought it was important to ensure that bars and restaurants were able to come into compliance and have the appropriate amount of time to do things that they needed to make changes. And so for most businesses that aren't bars, or for most businesses who are restaurants that don't have the separate ventilation system, those will have to come into compliance in July. And what that means is for public areas that are enclosed, smoking will not be allowed. Also, in addition to that, it will be the smoking distance from the doors of all public places. So it would be 20 feet for those places who allow entrance to minors from doors, public doors, and open windows. And then for those that do not allow those under 18, it's 5 feet from the door. So that includes like places like Walmart or Sam's or things like that. People will no longer be allowed to smoke from 20 feet from the door.
And that's any door, right? So if there's a worker taking a smoke break, because I know that's been a question a lot of people have had, it's 20 feet from any location.
It's 20 feet from a door that the public would use.
Oh, okay. So maybe in the back door that wouldn't necessarily apply. The workers would still be allowed to smoke out there.
It just depends. So if you have a place where delivery drivers come in, or if you have a place where other people come in to bring things, like a mailman maybe come to bring things to your building or things like that, then that's a public entrance. So you have to be 20 feet from that door.
Okay. Now, I know there's a lot of other questions, of course, which we want to get into, but I just want to start with why the health department and the coalition who came together and made this up felt it was so important to even enact in Wichita Falls.
Great. One of the things that the Health Coalition of Wichita County and the Health District both really have a vision for is healthy people and healthy communities. That's really our vision and what we see for the community. And one of the top priorities that they thought was to, one, reduce exposure to secondhand smoke, and two, try to get the number of people who smoke in our community, try to get that rate down. It's currently 21%, which is really high. And so the coalition, looking at all of the different things they wanted to do, they felt this was the most important and the most timely. And so there were 36 other communities in our state who've done this, so they felt it was appropriate. And when we were moving forward, we really feel like this will really change the culture of health here in Wichita County. And that's the most important thing to us, is that people start embracing the health of the community, and not just for yourself, but for other people who you may be interacting with or exposing. And it's important that you take personal responsibility, but also understand that it's a community as well, and we're all part of that. So this is really timely, and we're excited about the possibilities.
You know, you've heard the comments maybe on Facebook, or I'm sure maybe a phone call or at the different meetings about feeling it's infringing on them as a smoker, and why is that being taken away from me? But this all goes back to, if I understand correctly, secondhand smoke.
Secondhand smoke is really an important medical concern because it does impact other people who are around you, whether it be your family or your friends or the people that you're at a concert with or the people that you're standing next to at a bar. And so one of the things we thought was important was to reduce that level of exposure to secondhand smoke. What the Surgeon General tells us is that there is no safe level of exposure to secondhand smoke. So for us, it's really important that we limit those activities that would infringe upon someone else and their health. So if you want to smoke in your home or in your car or in your personal space and it doesn't impact someone else in the public or in the community, that's your personal choice and your personal right. But once you are in a business that is a public business, that impacts other people. And so we have to be considerate and cognizant of all of the different health outcomes of those who are in our community. Our health outcomes here in Wichita County are not very good. Out of the state, we are the lower 1/3 in health outcomes for the state, whether that be the length of life or whether that be certain health conditions such as diabetes or heart disease or stroke. We are the lower 1/3 of the state. So we need to start taking action to ensure that we are making whatever strides we can to help our community be healthier. And secondhand smoke exposure is one of those ways, because what we know in those communities that have done this, there were hospitalization rates that were significantly decreased within the first year of having a ban. And that's important. We're really hoping that we'll see that in our health outcomes in the future.
That definitely will be something neat to look at, to take those numbers a year from when this takes effect and to kind of go back. But not everyone, though, is going to be maybe enacting it right away, because it kind of goes back to that grandfather clause. Right. We're going to talk about that. Maybe the restaurant you walk in, when you'll start noticing a difference there. Right after the break, text home to stay with us. Welcome back to Inside Tech Selma. Once again, we are talking about a smoke-free falls and a smoking ban ordinance that passed in the falls recently. It's going to officially take effect July 17th. I know when it comes to some of the restaurants and the bars in town, there's a bit of a different timeline. Can you kind of walk us through that timeline to comply?
Sure. For those places that have bar permits prior to October 1st, they will be allowed to continue to have smoking in their facility for a period of 2 years from the date that the ordinance was passed. So that will mean June 17th of 2016. They will have to go completely smoke-free. For those restaurants who operate as a restaurant that have an active permit with us, they will also be grandfathered for those who meet our current ordinance, our 94 ordinance, which is that they have separate ventilation. So there aren't that many, I believe there's 13 or so, but they will continue to be able to operate as they are for that 2-year period.
It's all 2 years if it's a grandfather.
It's all 2 years. The only difference is for the bingo parlor or for the bingo hall. And we have one here in Wichita Falls, and we met with them and discussed some of the changes that they could potentially make. And one of the things that they are going to do is build an enclosed area within the bingo hall itself to separately ventilate that smoking and non-smoking. And their goal is to build their customer base. So we gave them a period of 3 years to come into compliance, just because the nature of their business is so different, and right now there's just the one. So then they will be completely smoke-free in 3 years.
But for any new restaurant that builds or comes to town, which we always love to see, it's immediate, correct?
Yes. Yes, they will have to be in compliance with this ordinance.
Now, let me kind of go back to the ventilation system, because I know the separate ventilations, that was such a big thing for our community 20 years ago. Why was that not enough?
Ventilation systems are limited in their capabilities to actually limit exposure to that secondhand smoke or other things that are in the air. And so what we know is secondhand smoke is still present, and ventilation systems simply don't work. We know from what the Surgeon General tells us is there is no safe level of exposure to secondhand smoke. There's just not. And so over the years, 20 years ago, the ordinance was very progressive. That was a very big deal for the passage in the 94 timeframe with the information that they knew then. And we know now that separate ventilation systems simply do not work. And so that model didn't work for us 20 years later.
Another thing is patios. There's going to be a bit of a difference if you go to maybe a restaurant. The inside, of course, will be smoke-free, but the patio, you could see people out there lighting up.
You could. They still have to meet the distance requirement. So if you are a facility that serves the public of all ages, then you have to have that 20 feet requirement from all of the public doors for your patio. And if you are a age-restricted facility, 18 and older, then you still have to meet that 5 feet requirement, but you can have smoking on patios outdoors.
Why was it important for in the restaurants if it maybe was already all smoking to enforce this, who were you trying to protect whenever it came to those particular cases?
And I've heard the argument that, you know, working somewhere is a choice, and people choose to work there and they can go somewhere else. But, you know, we had stakeholder meetings with bars and restaurants. That was our first stakeholder meeting that we had. And one of the people who worked in one of our local bars, a really popular local bar, stood up and he said, "It's my choice, and I make so much more there than I would somewhere else." And so when you're talking about people who have families, or people who are in college and school's expensive, or, you know, they're just making choices, oftentimes in our 20s and 30s we make decisions that we wouldn't necessarily make in our 40s and 50s because we know of the health outcomes later in life, or it feels like it may not ever impact us, so we may not get sick, or it's, you know, it's my choice. And so one of the things is we have to understand that although there are arguments that say, yes, you can work there and you can choose to work somewhere else, what we know is that oftentimes people make the choice based on their finances or based on their family, and we need to protect those workers' health as well. And the other part is we have shared medical costs. So if you go in and you don't have insurance, someone has to pay for that cost, or when you turn of Medicare age, we will be paying for your health care. So it's important that we understand that it's a shared cost, it's a shared burden, and it's a community responsibility.
So coming down to those employees, and maybe even at the restaurants, I guess, as well, then coming down to protecting them.
Absolutely.
Whenever it comes to parks, I know there's been a lot of confusion there as far as what you can do, if you can light up. So we want you to set the record straight for us.
It is confusing just because there are so many caveats. And so one of the things we thought was important was in terms of parks, that wherever children or families gather, that's basically how you can think of it. So wherever children and family gather, you cannot smoke within 20 feet of that public gathering. So for example, my family and I go out to the summer concert series that the city supports, and the distance requirement from that will be 20 feet from that event. So they set up the stage, you put out chairs, you know, you stand around. It's 20 feet from that event out, so that people won't be smoking next to children or families. And then it also is pavilions or playgrounds and other places such as the farmers market. Families gather there a lot. And then also seating areas of outdoor venues or events, complexes, things like that, anywhere families and children gather.
Now, I know whenever it comes to public, pretty much anywhere I guess you would think besides your home would be public, but you know, you talk about public streets or public sidewalks, and I know that there's been a bit of confusion even there. You can still, let's say, walk around your neighborhood, I guess, if you wanted to, on the sidewalks, correct? And they could technically smoke a cigarette if they wanted to, even though that's a public place.
Right, right. And it's an important clarification because it's something that's gotten confused oftentimes in the public. And it's, you know, the definition in the ordinance is simply that a public place is an enclosed space. And of course we define enclosed, you know, doors and windows and things like that. And then the distance from the doors was important because families walk through those to get into those facilities. But as far as public streets and things like that, not included in the ordinance because it's not considered an enclosed space unless it's part of that distance requirement.
All right. No, we just wanted to set that straight. I know there's so much to get to this morning, and we really wanted to touch on some of the big things. Has there been any other questions that have come to you that you'd like to help us clear up this morning?
I think a lot of businesses just have questions in terms of some of the specifics to the ordinance. You know, I spoke with one yesterday that where they would traditionally have their employees smoke actually was up against a fence that was a playground of a place where kids could come play. So it's just there's a lot of different caveats to it, and you know, we're here to answer those questions. And if people want to call, we have you know, we have the ordinances available on our website if people want to read the ordinance. But you know, we're trying to answer all the questions and be as informative as we can.
Sure. Absolutely. And you definitely can. We'll put that number on the bottom of your screen, also the website, in case you have any specific questions. But again, you can also head to newschannel6now.com. We've done lots of stories on this. We've been, of course, keeping you covered since before this even got started, Texoma. And we're going to stay with it. You know, even maybe have you back in a year from now. I think that would be very interesting to see the numbers and really if it's impacted our community like the final goal is here. But again, that's not the only thing they're doing. They are also taking other measures. In fact, I know an interesting statistic we'll leave you with before we take a break. You said 90% of people who smoke now actually started before they turned 18 years old. So it's a startling fact. We're going to talk about what they're doing now to, of course, reach the young people in this community and the different things they have going on, including free classes if you'd like to kick the habit. So stick around, Texoma. We'll be right back with much more. Welcome back to Inside Texoma. Once again, we are talking about a smoke-free falls. We're sitting down with the Wichita Falls Public Health District today, and joining me now is Arlene Weatherby, and we appreciate you being here. She's the health educator in Tobacco Prevention and Control Coalition program. So thanks for being here with us.
Well, thank you for having us.
Absolutely. We're excited to talk about this morning. There's so much going on that I didn't even realize really was taking place, so it's neat to learn about this morning. We want to start with the free adult smoking cessation classes. Perfect timing, as we tie into the new ordinance that's kicked in. And the best part is free. We said free.
Yes.
So can we go back to this? I know Tuesday it all kicks off, right?
Well, that will be our third class. Actually, I taught the first class a couple of weeks ago, and we had several people to come out and who completed the classes, and they got their certificate.
Wow.
They were very happy about it. They actually had set a quit date. I have one in my mind right now who is going to quit on July 14th, and I gave them each birthday cards to tell them happy birthday on their quit date. And these classes are free. They're called Fresh Start, and they are sponsored through the American Cancer Society. We got trained through them to teach adults 18 and older how to become smoke-free.
Why is this an important class, do you feel, to offer? I mean, you teach this class, obviously something that's very passionate to you. Why do you think this is important to have in our community?
Well, I'm new to this community. I've only been here 4 months, and when I came, I loved the mission of the health district. It is to promote, protect, and prevent. And I believe that if we can prevent our younger kids today to not smoke, we will have a generation in the future that will not be smoking, and they can teach their generation. We are here to promote the education. It's free. It's through a state grant. And we want our children, our adults, our older people to be protected, when it comes to smoke. A lot of people, they know that tobacco use can cause different kinds of cancers and different kinds of illnesses. And we just want people to have a healthy life here in Wichita Falls. And I want people to experience fresh air.
Can you tell me, when they come into these classes, what are some of the things that people can expect? If they come on Tuesday, is it, a week-long class? Is it just that day?
On July the 15th, that's another class that's going to start up. They can expect a small, intimate group of people who are smokers, someone that they can relate to. I am not a smoker. I've never been a smoker. I can't relate to them on that level, but talking to them and teaching them how to talk to each other. The last class that I taught, they became friends. Some exchanged phone numbers, and so they can talk to each other afterwards. But these classes, there's 4 sessions. They're on Tuesdays and Thursdays for 2 weeks, so that's 4 hours of classes. They will get a Fresh Start book. They will get a calendar. They will get incentives to help them stop smoking.
Do you think that it's important to have something like this free in our community too? Have you heard people say, if it wasn't free, this isn't something I could do?
Well, actually, when I first moved here, I started going to a lot of health fairs. When we told them that we were going to be doing these free classes, they were excited because a lot of people do not have insurance who would cover something like this. They said, "Are you sure it's free?" And I said, "Yes, I'm sure it's free." And that is a burden off of a lot of people because the way the economy is now. I'm just so grateful that the grant is here in Wichita Falls to help people who cannot afford to, buy the gum or the Nicorette or anything to help them stop. So yes, it's good for this community.
if they would like to call, can you tell us where they need to go, of course, for the classrooms, and we'll start with the phone number for who they can call.
Okay, the phone number that they can call us is 940-761-7827. That's my number. And then we have another health educator. Her name is Amanda Kennedy. Her number is 940-761-7840. And they can call either number. If we do not answer, they can leave a message and we will get back to them as soon as we can. And if they want to just come Tuesday, July the 15th, they can come to the east side of the building with the blue awning and just come in that side door, and we will open our arms, welcome them to this, to help them start a smoke-free life.
All right, well, we're excited, of course, to hear much more about this. If for some reason people cannot take part this week, are you going to have more coming up in the future? I know it's based off of a grant, but...
Yes, actually we have them scheduled through December.
Oh, okay.
We don't have them down packed, but they are scheduled. And if we get enough people to come in, we'll be more than happy to help them. A minimum of 5 people and as many as we can get in a classroom.
Okay, well, that sounds good. Well, Texoma, then it's all up to you now. Of course, just let her know. But that's not all you're doing. You said prevention was a big part. Can you talk about what's underway when it comes to the youth in our community?
I don't know if you're aware, but over 3,000 kids a day under the age of 18 start smoking in the United States. And we as adults need to know that we need to be out there to help these young people. A lot of the young people who I've come in contact with here in Wichita Falls, they are quickly to tell you someone in their home smokes and they don't want them to smoke. The children, I think they're more innocent when it comes to it, and they love their parents and they want them to quit. And they want it, and they're so excited about going into different places where there's not any smoke anymore. But we do have a program called Tattoo, Teens Against Tobacco Use, where we have been trained to train teenagers to actually go out and teach younger kids about not smoking or using any form of tobacco. We have a group right now at the Boys and Girls Club on Armory Road. They're teaching right now on Thursday mornings, the younger ones, and they're really excited. The younger kids are excited about doing it, and it really is a good program because they look up to those teenagers, and I want to be like that when I grow up. So yeah, it's a wonderful program up through the American Lung Association.
I love that. And not only do those kids, of course, look up to the teens, but I'm sure it gives them a sense of purpose and value, huh? Of teaching those little ones, pouring into them.
It does, and they love taking the quit cards home to their parents or these flyers to let their parents know when the classes are. It seems like they're just happy to know that someone is there who cares about someone that they know who smokes.
Sure, absolutely. Now, you're not just stopping at the Boys and Girls Club, right? Can you tell us what's the plans for later on this year?
Well, we're looking to get into the schools in Wichita County this fall to train teenagers to teach the younger ones. And we're excited about that, and we're just waiting for them to tell us when we can come.
How do you think that's going to impact our community, this tattoo program?
I think it will impact our community a whole lot because we listen to children. And when our children have a passion for something, it seems to draw the adults into it as well. And I think it will help Wichita Falls become a smoke-free community. And we do have a goal to decrease it 5% in 5 years.
All right. Have you seen another tattoo program in any other part of the country or another part of the state?
They're doing well. The community have taken them in well where they are, yes.
That's great. That's great.
And it's good that it's sponsored through the American Lung Association because it makes it more reputable as well.
Sure, absolutely. Well, I know that's exciting about the school districts, and of course we'll be keeping in touch with them on that and see how that goes when kiddos head back to school this fall. So, Arlene, we appreciate what you're doing in our community and how you're investing, and glad that you're here in our community as well.
I'm glad to be here. I'm glad I have this opportunity.
Well, thanks again for joining us this morning. And Texoma, thank you for joining us as well. Again, if you'd like to learn more about this, you can always head to their website. That's at the bottom of your screen. You can also head to newschannel6now.com. There's lots of content there for you to check out and read over yourself, especially when it comes to this ordinance, so you can find out how it affects you and your family. So again, thank you so much for joining us. We hope you have a wonderful day. And as always, we'll see you back here next Sunday morning for another look inside Texoma.